South Africa, HIV prevalence among young people is higher in females than males, with rates of 24.5% for 15 to 24-year-olds and 7.6% for males. The prevalence increases with age and is higher in urban informal areas. An estimated 271,000 children aged between 0 to 14 years old live with HIV and AIDS in South Africa. Social worker Phakama Mda works with these vulnerable children, addressing challenges like treatment refusal and ensuring their parents disclose their HIV status. And she joins us now for more on this conversation. Phakama, thank you so much for your time this evening here on SABC News. I want us to start off here. It seems as if young people in South Africa remain to be one of the biggest challenges when it comes to new infections. Do you think that young South Africans are still taking HIV and AIDS seriously?
Most young people, thank you very much for your time and giving me this opportunity. Young people in South Africa, they do not take it seriously. We are trying by all means to ensure that they have got all the information pertaining the HIV and AIDS by doing the awareness campaigns, by going to schools, using local radio stations and all social media platforms. But by the look of things, we still have a high number of people that are being infected on a daily basis. For example, we have got pregnant women that are not adhering to treatment, that are supposed to be taking ARVs. We have got negative pregnant women that are not taking PrEP as a precautionary or as a prevention method so that they cannot transmit HIV. There's a number of cases where we are invited as social worker, whereby a pregnant woman will give birth to an HIV negative child. Later on, you find that the child has been infected by HIV because the mother breastfeeded the child and then she contracted HIV from not from the father. Maybe they've separated with the father and then the mother contracted HIV and then infected the child through breastfeeding. We are always advising pregnant women, HIV negative pregnant women, to take PrEP so that they do not infect their newborns. And also pregnant women, we are also advising them, those that are HIV positive, to kindly take the treatment the right way, to adhere the treatment, because in 2024 we are not expecting mothers to be giving birth to HIV positive kids, because the treatment is already there. It's free of charge. It's available in all health facilities. But we still have got kids that are born in 2024 HIV positive. We have got a huge challenge in Chris Hani district, where I'm based in Eastern Cape, of young people that are not adhering to treatment. Some of those kids, some of them, they haven't been disclosed. They were told that the treatment that they are taking, it's for vitamins, some of them it's for asthma. And later on, these kids, they discover that these are ARVs and they become rebellious. They do not take the treatment. Some of them, you'll be told that, no, this kid is not adhering to the treatment because he discovered that these are ARVs and the mother didn't disclose. So it's one of the challenges that we are trying to fight in Chris Hani, to ensure that the kids, they know the importance of taking treatment. They are very aware that living with HIV in 2024 is no longer a taboo. You live a normal and long, healthy life, even if you are HIV positive.
And Phakama, you know, you've laid out saying that when it comes to pregnant mothers, I mean, there is a free healthcare, there's enough education that's been done, enough consultation with, pregnant mothers. Why do you think that we still have this problem where you still find children, newborn children, who have contracted HIV and AIDS?
Firstly, most pregnant women do not go early to the health facilities to do their bookings. When you're pregnant, you have to start early classes, antenatal classes that are done by pregnant women. Yes, you are supposed to start them early, but you find that they go there very late. And then that's when the virus is like they're diagnosed, it's very late for them. And some of them, they are going there late, whereas they know that they are supposed to take treatment. Some they go there, yes, they go there on time, but do not take the treatment. So we still have to preach the gospel, especially to pregnant women. We have got a challenge there, because when you go to the facilities, you'll be given a list of pregnant women that are not adhering to the treatment. And when you call them to find the root cause of non-adherence, you will be given an excuse that the facility is far, I do not have money, all those excuses that you see that, no man, this is just a lame excuse. One can just go to the facility, especially now, because now we have started, the health facilities have started what we call MMD3, which is multi-month dispensing, whereby a mother, if she or he is adhering to the treatment, is given 3 months supply. But they are not adhering to the treatment, and some of them, they are not even honoring clinic appointments. So we still have got a challenge there, and I still strongly feel that we still need to go there. We still need to tell them that HIV in 2024 is not a death sentence, and we shouldn't be having kids that are HIV positive, that are born HIV positive, whereas all the preventative measures are in place. So I kindly ask all South Africans to please adhere to their treatment.
Yeah, and I like the fact that you touch on the fact that in 2024, no child should be living with HIV and AIDS, and no child should be born with HIV and AIDS. And maybe let's touch on, what that does then to a child. You touched on the issue a bit earlier on, saying that some of the parents don't disclose to their children that they are actually taking ARVs. What does it do to a child's psyche when they start learning that they do have HIV and they're actually on medication because of HIV?
I will start with the little ones. The little ones that later discovered that they are HIV positive, whether the mother gave birth to an HIV negative, then later on seroconverted to HIV. You will find that they neglect those kids. They leave those kids with the grannies, or the mother will move from Cape Town to just come to the rural areas to leave the child with the granny, and not even inform the granny that the child is HIV positive. So as a social workers, you will be told that there is such case of a child that isn't taken care of. When you get there, you'll find that the granny doesn't even know the status of this kid. The mother didn't disclose to the guardian that is looking after this grandchild. Now, coming to the teenagers, they become rebellious. They do not want to hear anything, especially when it comes to HIV. So we are trying by all means to go to schools, to create awareness there, to inform them, to educate them, having youth indabas, initiation indabas, everywhere, the women's events. We try by all means, youth events. We try by all means to get more young people so that they can be part of HIV education. Like, inform people, empower them. They must know that HIV doesn't kill. Also, one of the things that are a challenge when it comes to young people, as I've mentioned, it's the disclosure. Parents do not disclose to their kids. They do not tell them anything. Even if you ask a mother, why didn't you tell the child? She will tell you that I'm not ready. I know that it's not an easy one. But when it comes to teenagers, at least tell your kid. Arrange with a professional nurse to come and assist you. Yes, we are not disclosing, but we are educating. You as a parent, you must disclose. You must tell your kid what happened, how to contract the HIV. So parents, please disclose to your kids.
All right, Phakama, thank you so much for your time. That is Phakama Mda. She's a social worker. They're talking about children who have contracted HIV and AIDS from a young age, and urging parents to inform their children very early on when it comes to this infection.